How you doing, Eric?
I'm good, man. Thank you.
Dr. Romig with Stella. So today we're going to be doing the stellate ganglion block. So I just want to talk to you a little bit about it. Here at Stella, we do what's actually called the dual reset block. So we're blocking at two different levels, at C3, C4, and at C6. And what that does is it gets not only in the stellate ganglion, but the actual superior cervical ganglion too. And a good way to sort of think about it is those two, the stellate ganglion and superior cervical ganglion, are the CPUs for what we call your sympathetic system. And your sympathetic system is your fight or flight. And when you have a high, what we call sympathetic tone, or a high fight or flight response, you're always on edge. You're waiting for kind of the next bad thing to happen. Your heightened sense, heart rate variability is down. You just don't adapt, well to kind of the surroundings. And the theory behind why the stellate ganglion works, or the DRB works, is that think about it as a reset. As a reset for that system. And with the nerves from the stellate ganglion superior, they go up to an area of your brain called the amygdala and the hippocampus, and that's where trauma is stored in the brain. And in those areas, they almost look kind of like dandelion spindles. And what they're doing is they're pumping out norepinephrine.
Okay.
And norepinephrine is a neurotransmitter for fight or flight, and basically the spigot's on, which is why you're always feeling how you are. When we turn those off with the block, we actually see a pruning of that dandelion, and that norepinephrine surge is immediately shut off, which is why we see some people feel instantaneously better, because now they're no longer bathed in that neurotransmitter that causes that fight or flight response. We see pretty good results, about 80% of people just with the right. If we get a little bit of relief, or kind of halfway relief, we then do the left. We then see another 50% of those people that get relief. We want you to kind of take it easy today, so avoid caffeine, exercise, things like that. When we actually do the block, you'll see what's called the Horner syndrome. So your eyelid on that side will be a little droopy, the white part will turn a little pink or red, and your pupil will be a different size. Okay? That lasts anywhere from about 8 to 10 hours. It all comes back, I promise you. As I said, some people kind of feel instantaneously better, others it's kind of over the coming days, so we'll check up on you.
Okay.
I use ultrasound there, so we'll have you turning your head just like that. I get all my landmarks with the ultrasound. That's usually the longest part of it. And then I'll have two little purple marks that I make, and then I'll inject your skin with some local anesthetic. The lower block tends to take me a little bit longer, about 2-3 minutes. The upper one just about a minute. So any questions?
No, I'm excited and nervous. Thank you.
All right, we'll get going here.